Good evening. I'd like to call this meeting to order. This meeting is being recorded. I would ask if there's anyone else recording this meeting. Seeing none, if you'd please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good evening, everyone. Sorry for the short notice. As you are likely aware, this is a meeting regarding our re-entry to the schools this year and how COVID and masking may influence that return. So before we move on to the Superintendents Report, where Mr. Hanfield, Dr. Hanfield, will go over some of the facts collected and some of the reasoning behind what his recommendations may be, I will open it up to citizens' comments. I will ask that you keep the comments to just around 3 minutes. I won't cut you off at 3 minutes if you're in the middle of something, but I think that allows enough time where you're likely to not begin repeating yourself. And we may be hearing some of the same type of comments from other guests as well. So at this point, with a show of hands, and when you do come up to the microphone, I would just ask if you would just state your name and your address. And then again, I will, as I said, I will start the timer. If you go a little over, that's fine. If you have a lot to say, we'll take that as it comes. So is there anyone interested in speaking tonight? Okay, I'll take this young lady over here, if you would like to just state your name and address.
Hello, my name is Danielle Dowd, and I live at 1 Merriam Street here in Auburn. Good evening, Dr. Hanfield and members of the Auburn School Committee. I've been a resident of Auburn for the past 9 years. I'm the mother of an incoming 5th grader and have been a teacher in Massachusetts for the past 18 years. I am speaking here tonight in support of an indoor mask mandate for our school community this fall. Until there is a vaccine available for children ages 5 to 11, it is totally irresponsible to not have an indoor mask mandate in the Auburn Public Schools. We left school in June in a very different place. Cases were down, and with many adults in our area having received their vaccines, many of us started to feel more comfortable. However, just a few short months later, with the Delta variant spreading rapidly throughout our country, and with elementary-age children still not able to be vaccinated, we seem back to where we started from. And in some parts of our country, things are far worse than last year. We know there are risk mitigation measures that can protect our children from COVID-19. Frequent hand washing, outdoor classes when possible, improved ventilation systems, and yes, masks. I teach in another district in Massachusetts that has already made the decision to enforce masks for all staff and students grades K through 12 for the fall. Auburn should be doing the same. To the naysayers who think that children will suffer due to wearing masks yet again, I say to you, as someone who has worked with children and teenagers for close to 20 years, children are resilient. They adapted to wearing masks in many cases far better than the adults constantly complaining about wearing them. Why suddenly, when the variant is affecting more and more across the country, with some children being hospitalized and in some cases dying from the variant, would anyone think that now is a time to go maskless? Look to the southern states that do not have mask mandates in place. They've already gone back to school and are shutting down, going completely remote because the cases are so numerous and their hospitals are completely overwhelmed. Do Auburn families really want to go through remote learning again? Wouldn't it be better to do everything in our power to keep our children rightfully in school? Why would anyone want to take a chance of their young child getting extremely sick or worse from the virus? My son is 10. He cannot get his vaccine yet. For all the children who also cannot be vaccinated at this present time, please mandate indoor masks in the fall. After children have been vaccinated, we can look at reevaluating the decision based on the data. But for now, there is just too much at risk. Thank you for your time.
Thank you, Ms. Dowd. Your timing was impeccable, and your message was heard loud and clear. Sir, would you like to speak next?
Hi, my name is Aaron Champagne. I live on 9 Melba Ave in Auburn, and I'm addressing this board and this committee as a concerned parent of 2 children in Auburn. They go to Bryn Mawr and Swiss, and I'm also addressing this as an educator who spent close to 20 years in the public school system as well. Regardless of the decision tonight, there's going to be some parents feeling upset. I understand that. But in saying that, I believe that now should be the time to base this decision on facts, not feelings. Facts, not fears. And I have many questions that I hope you can answer tonight. And if you don't know the answers, I'm hoping you at least take the time to think about these questions while I read them to you tonight. I'm hoping that if you really mull these questions over, you'll come away that it's absolutely impeccable. Excuse me. It's absolutely important that we keep these masks optional for schools this coming year. With 71% of eligible people in Auburn vaccinated with at least 1 dose, who are we protecting if we make masks mandatory? Are we masking the children in Auburn to protect them from something that has an infection mortality rate of less than 0.0005 and hasn't caused a single death between the ages of 0 to 18 in Massachusetts? Are we masking these children to protect other kids, even though they spent the entire summer without masks at each other's houses, at summer camps, pools, malls, movies, sports teams, sleepovers? We're coming in today, all these kids are outside on the fields playing maskless, as they should be. Are we masking these children to protect other kids? Are we masking these children to protect the vaccinated teachers who remain extremely, extremely protected, even if there happens to be a rare breakout case? Only 99% of breakout cases are from unvaccinated. Maybe 1% is for vaccinated. Everyone's extremely protected if they're vaccinated. We all know this. Are we masking these children to protect the unvaccinated who made a willing decision and are willing to accept any consequences to not being vaccinated and do not ask anything from anyone except the freedom to choose to be vaccinated or not be vaccinated? That's their choice. They're going to deal with the consequences, good or bad. Is masking these children a way to signal to other people that we're virtuous? Is this all show? Is this all theater? Or is it something that we're masking our own hypochondria and our own Munchausen by proxy disorder? Where's the evidence that masks are effective in stopping transmission in schools? From what I've read, it's non-existent at worst and flimsy at best. One study from North Carolina, all they do is measure against other schools that are masked. There's no baseline. There's no baseline because they can't measure against other schools because they were all masked. Where's the evidence that excuse me, are we setting our children up for future infections and disease by living in such sanitary conditions? Children need germs to strengthen their immune systems. Why are we concerned with transmission rates if most children are asymptomatic, rarely are hospitalized, and have a better chance of being hit by lightning than they do of dying from COVID? Why would we mask for COVID if we don't mask for the flu, which kills far more many children? How will our youngest children learn to enunciate and read facial cues? What are we teaching our children if they believe that the air they breathe is toxic, everyone around them is sick, and if they take off their mask, they may die?
Mr. Champagne, I'm just going to ask that you take another 30 seconds, since
Okay.
I only gave this lady 3 minutes.
Yep, absolutely. Okay, I read Mr. Hanfield's report. I saw that online today, and I know that you recommend masks for the school year. I saw that, but I know as parents and everyone up here, or I'm assuming has children, how do you feel if the decisions are taken out of your hands? All decisions are made and based for the best of our children. Mr. Hanfield, I know your daughter plays softball for BU. What if the coach came up during the game before it even started and said, you know what, we're going to sit you out? The AAP decides, pitching isn't good for elbows. Well, we're going to sit you out on this one. But Dad, I want to play. No, it's best for you not to decide this, honey. Okay, what do? We want these choices. We want these decisions. Okay, and my final thing, because I know I'm short on time, I'm sorry, that I believe that if you, at any time during this last 18 months, went outside maskless, went to a restaurant maskless, went to church maskless, went grocery shopping, went to the pools, went to movie theaters, you are for masks being optional. You made that choice. If you didn't mask up this entire time, inside, outside, wherever you've been in this state, you were for optional masks. Thank you. I wish I had more time. But my final quote, I sent it in the email as well, but it is easier to build strong children than it is to repair broken men. And that's what we need to do. We need to be brave in this. We need to lead by example, and we need to use some common sense. So let's build brave children. Thank you.
Thank you for your comments. Since we don't have a whole lot of people by the looks of it, Ms. Dowd, if you'd like to continue for a couple of minutes extra at some point, I will allow that. Would anyone else like to speak this evening? Sure. Yes. Just please state your name and address.
Well, super nervous because I have them, I think, prepared. It's Sharinda Trudell, I'm 41 Renbrook Drive. So being a prior employee of Auburn Public Schools, a medical professional, and also now a teacher, I just wanted to mention that a lot of quotes were thrown around about, vaccinated people, and I think that as an educator, especially in the school district, I think the concern is that 11 and under cannot be vaccinated. So, whereas, it has been stated that vaccinations are optional for teachers and whatnot. It's my understanding that it's been taken off the table for any option for remote, right? So, at this point, if we were not going to take a chance on masks, what's the option there? What's the option if, there's a teacher who doesn't want to get vaccinated? I'm not willing to chance my students' education for a second year in a row. I have 2 students in Auburn currently in 7th and 5th grade. So I just feel that, making it optional, especially for the age group that we're talking about, they don't even have a frontal lobe that's appropriately developed yet to really, make a decision of that scope. But I just feel that we don't have the option for the remote right now. So I'm not willing to take a chance with my children having to be out for 2 weeks, or the teacher being out, having to close down and not be able to take a remote day for the education the second year in a row. So I think if we're going to take a chance, if anything, having, like I said, worked in the Auburn Public Schools, let's reassess. I believe, go with the data right now. Let's reassess later on and see where it's going to change. I know when they took away February vacation for us, school nurses were a little bit like, okay, we need that time to kind of reassess what's going on with the disease processes of everything kind of out there. So I do believe in masks right now, mandated. Like I said, as a parent, a medical professional, and an employee, previous employee of the school district. So thank you for your time. I didn't have anything prepared, so I hope it was somewhat received. Thank you very much.
Thank you, Ms. Dowd. Appreciate that. You'd like to go again? Actually, just let me call upon someone up in the back there, and then when she's finished up, we'll wrap it up with your extra couple of minutes.
I promise not to take too much time. I'm Erika Bresaker, 5 Cooper Street here in Auburn. I also teach at Worcester State University, and so I see it from the higher ed perspective in elementary and middle school. I have 1 kid going into 7th grade, 1 going into 1st. My oldest is actually at Salem State right now, where they are increasing and changing their policies as well. So having this debate is really important. Having this conversation is important, particularly as we watch the school districts that are already open across the country. We have the benefit of having more adult vaccinations here in New England, particularly in Massachusetts. But as the previous speaker said, that's not the case for under 12s. And it's not really the case even in the data that Dr. Hanfield gave out, that in Worcester County and in Worcester specifically, right, it's like 30% there. It's 50% here for our 12-year-olds to 15s. That's not a big enough cushion, I think, for the kids that haven't been vaccinated yet. That can cause spread and that with the Delta variant in particular can be spread by vaccinated people, or at least carried. I mean, there is still the risk there, and there's a lot we don't know about how the Delta variant varies from the initial outbreak of COVID, which I think were some of the stats that one of the previous speakers was talking about. And so I think in an effort to really protect our youngest kids who just don't have any of the other tools that some of the older kids do, a mask mandate right now with keeping on top of things, reassessing, changing. That was something that they got used to doing last year that I think as a society we all have reassessing as we get new data. And so I just wanted to speak in support of a mask mandate right now. Thank you.
Thank you.
Is there anyone else that would like to speak before I recall Ms. Dowd? Seeing none, if you could just keep it to around 2 minutes, since I gave Mr. Champagne closer to 5 minutes.
Sure. Just to kind of refute what was said earlier, I mean, if you're not putting a mask on outside, I think that's a big difference. What we're asking for is an indoor mask mandate. And what the previous speaker just alluded to is the fact that these children cannot be vaccinated yet. Yes, they might be living in homes where there's vaccinated adults, but once you put everyone back together again, you know, it's a recipe for disaster. And again, if anyone's looking at the news and looking at what's out in the world now, it's a mess down in the South. Their hospitals are completely overwhelmed, and they have no mask mandate, and they have no child vaccinations. And yes, granted, they have a much lower adult vaccination rate, but why would we want to put our kids through that? You know, with outdoor mask breaks and with, other things in place, it is what it is. As I said earlier, kids are resilient. I think the adults make far more of a big deal about this than the kids really do. I would much rather have my son in person learning with a mask on than having another year isolated. So what's it going to come down to? If we look at the data, the numbers are going up. I know they're not purely as up as some other states, but the packet that you guys sent out, 21 cases on August 5th, 28 on August 12th. When's going to be the cutoff? Like, why of all times is now the time to go maskless indoors? So I think, I would hope that the school committee and the superintendent would really strongly encourage this. And it's not something that's set in stone. It's something that we'd reevaluate and look at. But we got to give these kids a chance to get vaccinated, and we just don't have that yet. So why put them through this? Why put them through going to school and having to come home and be quarantined and go through this all again? We know masks help. So let's please keep them indoors.
Thank you once again for your comments, and I would like to thank you all for your comments. And I can relate in various ways to each of the comments made by all of you, and I appreciate you having the courage to come up here and speak your mind. And I will now turn it over to Dr. Hanfield for the Superintendent's Report.
Thank you, Mr. Chair. And first of all, I'd like to thank all of you in the viewing audience this evening. I'm sure there's many. I'd also like to thank the dozens and dozens of you that sent in emails to myself, to the school committee, expressing your views on this matter. And clearly they're wide-ranging. To those of you here tonight, thank you very much. And Mr. Champagne, Julia probably enjoys the shout-out. She's home watching the meeting tonight, so thank you very much. She probably didn't realize she was going to get that mention. But in any event, thank you. This is such a polarizing issue right now, and it's a very, very difficult thing to grapple with. The documents that I put out, and really not knowing what we were going to have for a turnout or what the turn of the conversation would be, really just served to frame the conversation, or at least where we've been. And I'm not going to go through this in great depth, but I'm just going to kind of summarize this and then kind of get into some of where I am with my thinking as we get ready to start the year. I think if we look back at last year where we started, when we closed schools in March, and then we proceeded through the year, I think what you can see is that we were, I think, appropriately measured in our response to educating our kids. I think that being one of the first school districts to come back K-12 and make that announcement in February demonstrated the importance that we all have in getting our kids in school, in person, every day, and safe. At that time, we had a plethora of options from DESE. We still had remote, we still had some hybrid, and then DESE changed course on us to where it was remote and full in person. And then at the end of the school year, if you read their guidance, and I'll go through that in a little bit, you'll see that within their guidance, at the very top, it's very bold and very explicit that it's full-time, in-person, 5 days a week. There is no remote option. DESE's not giving us an answer on what do you do if you have a breakout of 25 students in a school. There is no guidance from them. There is no guidance from them. They're absent. That was the answer we were given from Malden, Massachusetts. Well, they're just absent. Absent for 14 days, absent for 10 days. So that's very concerning. That's very concerning to us that as we understand the importance of back to school, full-time, in-person learning, we have no tools in our toolbox other than, well, they're absent. So, for me, as a superintendent, one of my considerations is from the 10,000-foot view is how do we ensure to the best of our ability that all of our kids are in our schools and getting full-time in-person instruction. There's a lot of studies out there, and Mr. Champagne, you referenced it, I've got studies from all over the place on both sides. I tend to be, at least in my thinking, I tend to be really somebody who's interested in the local data, right? And so what influenced my decision to send us back or recommend we come back full time was that through the process that we had followed, we did not see school spread of this virus. And I was willing to take the chance that we could come back safely full time and in person. And so we made that decision. When we got to the end of June, DESE listed all restrictions. I think we all understood, and I think we all felt that the virus was in a place that was under control. I think we understood that most adults now had an opportunity to be vaccinated, and the ability for the concern in school, while there was still going to be some concern, I think we were leaning, at least I was leaning, towards more of a mask optional piece, knowing full well that our 0 to 11-year-olds would not have the opportunity to be vaccinated before they came into school. And I know that comes up a lot too. People will talk about parents' rights, and I understand that 1,000%, and I support it. But I guess the other side of the equation is, as a public school system, if you're potentially making a decision that could potentially be causing harm or to the health of someone else, I guess that's where, for me, that's kind of the red line. If and when, and I hope it's very soon, we get to a place where our 0 to 11-year-old students have the ability to be vaccinated, then I think we've all made our choices. And I think then we start looking at, and this is down the road because we still don't have a date on that yet, but I think then maybe we start talking about, what we do at that level. In July, we have the issue that happens in Provincetown, and that then turns the CDC around, and they come out with 2 recommendations to us. And their second one is a little bit more forceful than the first, which is that vaccinated people, unmasked, do have the ability to transmit the virus. There's enough viral load, according to the CDC, in vaccinated and unvaccinated, to where that could cause a problem. DESE comes out with their, as it's explained earlier, DESE requiring full-time in-person, full-time 5 days a week. And then they go through all of their different requirements as to what is going on indoors. And you're right, everybody is outside unmasked, and the guidance doesn't call for having people masked outside, and we wouldn't I think ask for that at this point. I think what we're looking at is really following DESE's guidance, with the exception of the optional masking piece. And so that's really our first priority. And for me, when I look at the different organizations, I look at the CDC, I look at the American Academy of Pediatrics, and it's difficult because what they say is in contradiction to Mass DPH and is in contradiction to, in some respects, to the Mass Department of Education. And so it really puts kind of a confusing, and then don't forget that, but you have to wear your mask on the buses and you have to wear your mask in the health office, but it's up to you to do what you want indoors. We're coming back from a summer where we've all been outside. We don't know where people have been. We don't know where they've been in terms of, hot spots, and, could they potentially be bringing that indoors? I go back to, we had a very successful run of getting our kids in school and getting them educated in person. And how did we do that? We did it with masks, and we did it with other mitigation strategies, sanitization procedures. We did it with airflow. We did it with our zip slips. And so I kind of go back to that because I know locally for us, that's what worked. Now, that being said, where are we as a county, right? So we look at just kind of some data here. Worcester County is now elevated to a substantial transmission county. And just as an example of how quickly things change, when I did this on Friday, Franklin and Hampshire counties were not considered a county of high risk or high transmission, or substantial transmission rather. And over the weekend, that changed. So every county in the state's now a substantial transmission county. So I looked at it that way. And then I did look at the town cases, and 0 starting July 1st, less than 5 on the 8th, less than 5 on the 15th, but 6, 12, 21, 28. And you start to see a little bit of an uptick. And that's concerning. Now, if we look at vaccination rates by school age, obviously our kids 0 to 11, they can't get vaccinated yet. But when I look at our ages 12 to 15 population, there's 804 in the town, 352 are fully vaccinated. Ages 16 to 19, we have 708 that are in our population, and we have 537 that are fully vaccinated. The difficulty with those numbers, though, is that when you stretch it out to the 19, there's a lot of college kids who just graduated, high school graduates who are now going off to college. And so I'm sure there's a large segment of that 16 to 19 population that is comprised of kids going off to college. The 12 to 15 category isn't as high as I'd like, but I'm encouraged by it. It's much higher on both ends than it was, say, even in the spring. So, kind of in summation, DESI's mandated this full-time in-person instruction. I look at, kind of just the quick organizations that I cited. Those were the go-to organizations that we looked at last year when we were creating our return to school guide. And I'm of the mindset that I think evaluating this on every 30 days or so gives us an opportunity to see, are we going to see something with the Delta variant where it spikes and crashes like it did in Great Britain, right? Possibly. Are we going to see an announcement, seemingly from the CDC, that all of a sudden 0 to 11-year-olds can now get vaccinated? I don't know. This morning, we just hear at first that, within the last 2 weeks, when we look at vaccine information, we're getting information that, you might need a booster shot, then, just immunocompromised, and then now today it's, everyone after 8 months, and all of those things. And so for me, there's just too much topsy-turvy information there that I think we need to get a little bit a better handle on. I also would like to see us get a bit better handle on the actual in-building data of kids who are vaccinated. I'd like to see what are the cases of COVID once we start the school year. What does it look like in our buildings? You also have to keep in mind that we haven't had all of our kids back into our buildings. Last year, we had a large segment of our kids that were also remote. And so what does that look like, adding that extra layer to it? So there's just a lot of unknowns. And then, of course, like I said, what do you do if there's a breakout? And I know none of us want to go back to, that type of a scenario. And I know that there's a lot of people that will say, yeah, but what's the likelihood of that happening? Well, I appreciate that. But I'm also the person who has to sit here and look at it big picture and say, but what if it does? Then what? And so, we need an exit strategy out of masks. There is absolutely no two ways about it. This is not something that I feel is sustainable. But quite honestly, I think I've been very candid with you through this entire process dating back to last year. I don't necessarily know what that exit strategy is right now. I know that there's the DESI's recommendation is differential masking, which basically says at 12 and older at the middle and high school level, their recommendations are, for those of you who are vaccinated, not to mask, but then those of you who are not, those of you who are vaccinated don't mask, but then those of you who are not vaccinated have to mask. I just wonder a couple things about that. I wonder, what type of dynamic does that set off inside of school buildings with kids wearing masks and some kids not wearing masks? What type of, dynamic does that set? I wonder, who's going to be in charge of enforcing masks, in schools? Some of that information is very private, and I can't see a homeroom teacher taking roll call and saying, do you have your mask on today? Do you have your mask on today? It gets to be, complicated. And I know a lot of people will think that some of these things aren't big deals, but when you take them in the sum total, it all kind of gets wrapped into the picture. So, I'm one voice, and I respect everyone's opinions on this, but I tried to strike a recommendation to the committee that I felt balanced the needs of everybody and gave us an opportunity to get our kids in school, get ourselves off to a good start, figure out, is the guidance going to change or not going to change? It seems like it's changing rapidly right now. And just kind of see where we are locally. What's our data? What's going on in our buildings? How are people feeling? And then start talking about, do we start to go maybe move to a differential policy? If data in the tenor of the community, is willing to entertain it. So I apologize if I was all over the place. I tried to be as succinct and capture as much of my thinking, but also to address some of the issues that were raised. And so that's where I am right now. So that's my recommendation to the committee would be that we do start the school year fully masked, and that we not reconvene, but we revisit this, on a monthly basis and see how things go.
Thank you for those comments. That was well over 3 minutes, but it's okay.
I apologize.
A little bit of leeway. There has been a recommendation made by the superintendent. I would entertain a motion to recommend.
I make a motion to continue masking be required for all individuals in the Auburn Public Schools regardless of vaccination status to begin the school year. The continued requirement will be revisited monthly with the school committee as well as with current recommendations from national and state agencies, as well as a review of local data.
Do I have a second?
Second.
I do have a second, and now I will open it up to discussion. Any commentary from the board?
You can start with Gail and just work our way down.
I've barely been able to hear whatever's been said. I guess you just read the motion at the bottom. I agree with that as long as we're going to revisit it. And if things get better, then throw the mask out. But if they don't, then I believe we have to because of the younger children that can't get vaccinated and the other young children whose parents don't want them to get vaccinated and they can't do anything about that. So I think we have to act on the safe side, which is to have masks for now and then reevaluate later.
Front couldn't hear me either.
Thank you, Ms. Soloway. Are there any other comments?
So through the chair, this is a very difficult situation for me. I agree with all statements. There is one thing that, and Mrs. Dowd, respectively, I agree with everything except for the kids are resilient and they're okay. I've seen my daughter go from absolutely loving second grade to crying every single day to go to school. I have a kindergartner going to first grade who doesn't know it's okay to pick up a pencil for another kid. I have my middle one won't go to a Woo Sox game, wouldn't until a few weeks ago because he didn't feel it was safe to be in crowds. And so and it's not just masks and it's not just social distancing. It's kind of a combination of all. I remember being at school, picking up one day, and I saw a third grade boy see a little girl fall next to him. And he just looked and watched her fall. I said, why didn't you help pick her up? He said, I don't want to get COVID, and I don't want to get in trouble. So that's my side on my issues with masks. However, my doctorate's in public health. And at this point, children under the age of 12 can't get vaccinated. I strongly feel, and I'll get on my little vaccine high horse right now, but that this could be prevented with vaccines. If people go out and get the vaccines, this can be prevented. And therefore, if we go with this recommendation, and to be honest, at the high school level, except for the fact that the state is not allowing us to do any remote, they're okay with mandating MCAS during a pandemic, but they're not okay with allowing us to do stuff like that, which is extremely frustrating. If a child is out in quarantine, how do we educate? That's my big concern there. However, at 75% of our high schoolers are vaccinated, I'm comfortable with that. In all the emails that I've gotten, and I totally understand them, people are fearful. People are fearful of this vaccine. Yes, it has a very, very low pediatric mortality rate. It does. It's not hurting children. We're not talking about, polio, right, where everyone was petrified to let their children go outside. This is a grown-up illness. This is an illness that is hurting grown-ups. However, I do feel very strongly that masks and social distancing are also hurting our kids. I have to also, unfortunately, and as much as it kills me, and believe me, none of my kids are old enough to be vaccinated. It kills me to vote tonight to say that my 9-year-old is probably going to hate school for another year. Hopefully not another year. If you asked me in June, I would have totally been different. I would have totally been on the opposite and said it's optional. Because, yes, I am one, Mr. Champagne, that my kids do go out without mask, or they did up until about a week or two ago. They're not, kids are not as resilient as one might think. I think this is going to have long-term impacts on our children. But as I explained it to my kids, I don't want them to bring it home, give it to somebody else, and that person die and have that on their conscience when they're older. So my feeling is that it has to be revisited and it has to go away once all kids, and I think the next step is going to be ages 5 to 12. It's not going to be 0 to 12, but 5 to 12 covers most of our children. At that point, once the bottleneck and all the kids get through, this has to go away and I'm hoping we're not social distancing these poor kids anymore.
No.
Because, if we can keep the masks on, but, I think about like kindergarten used to be tables and now they're 3 feet apart. So now we're going to have first graders who sit in class and get elbowed and start screaming at the kid because they're too close, because they didn't learn socialization skills in kindergarten, to no fault of the teachers, because let's face it, Auburn does have the best teachers that I've ever seen. So I guess I'm a little winded and I didn't get into the data, but I guess my big thing here is kids aren't as resilient as we think. We need to, as grown-ups, step up to the plate, go get the vaccine, do what we can so that our kids can go back to normal, and let's keep them normal. And if it has to be in masks for a very short period of time, my hope is that it will be available to children age 5 to 12 by October. I'm not on that committee, so I don't really know. But at that point, let the kids get vaccinated, and if it's cold and flu season and kids are getting colds and flus, that's okay. We can't hide them with masks throughout that whole thing. I just think about like facial, like I teach college, so, and even my students know my face, and they'll say that, like, oh, I can tell when you're angry because of your face. A first and a second grader, that's how they tell. And Mrs. Holloway will probably say 6th graders. How do they tell when you're angry? I remember knowing exactly when you were angry. So I agree on both sides. It's such a hard, dicey thing. So if I was at all comfortable, it would be high schoolers without masks, but I don't think we have a leg to stand on under that, personally.
Since no one could hear me before. So I respect both of my colleagues' comments so far, as well as everyone who in the audience as well. I personally am a proponent of full masking K through 12 regardless of vaccination status. In addition to the data, and believe me, I've read many emails very thoroughly, and certainly take all of that to heart. Just watching the faces in this room while different people are having different reactions, I want you to think about the tension that you feel as an adult, even to other people in this room. I do not feel like it is responsible for us on the first day of school, even for high schoolers, to come in. They are already going to be cataloging mask, no mask. I wonder why they don't have it. I wonder why they have a mask on. What's wrong with you? Did you get the vaccine? And have a child, maybe a child's just terrified because they had 3 or 4 family members die, like our family did. Maybe they have an underlying condition that they don't want to have to talk about. Maybe, and this is the thing that I do want to bring up, and I hope that our adults will have some compassion for unvaccinated children here, even in high school. In the state of Massachusetts, you do not have free agency until you're 18 to get the vaccine. So if you have a parent that is concerned for medical reasons or just does not think the vaccines are effective, children cannot just hail an Uber and go in. They need an adult to be there with them. So I also don't think we need to be masked forever and ever, amen. I do think we should certainly revisit this month to month, as Dr. Hanfield has stated. And what I would also like to do is, in anticipation of moving to a partially masked population in our kids, work on a framework, because in many of these meetings we talk about making sure that our kids are safe, making sure that we have an inclusive environment where we can discuss different opinions. I want to make sure that the moment that we can have part of our children masked and part unmasked, that everyone feels like their decisions will be accepted, because kids have rights too. They're, especially in high school, like they're these autonomous, almost adults, and I think we really, really need to respect that and make sure that they feel safe. And even their teachers, I don't want them to feel like, oh, well, they don't have a mask on, they're not going to understand why I'm afraid, or they're going to think something of me. I think to start off the school year, we need to all be on the same page, because there's a lot of other things we need to get done. I mean, we need butts and seats. We need kids to be here for education. They need to be able to, cut up. And frankly, I would even be comfortable with scaling back some of our other mitigation steps, maybe getting back into more of the clubs that we do, some of the other things that we kind of eased into at the end of the year, if we can keep mask universal. Because I think the more contact that these kids have, the better. And I think that that's going to address a lot of the mental health concerns that we have. So that's what I have to say.
Yeah, I do. I'm going to beat this dead horse a little more. So I came in here thinking K through 8 mask up. I still deeply feel that way. My daughter, I have one daughter who is not vaxxed and the other one is, and she's 14. Her and I paid a price when we both got vaccinated, and we were both really sick from it. We did that so that we could have more freedom. And, when I left tonight, she asked me how I was going to vote. And I said, it's probably going to be K through 12. And she said, but why did I get that shot then? And I said, well, we're all doing our best to make right decisions and everything. So, it's hard for me to say. She's going into high school. So it is difficult for me to say that high schoolers should mask up, because I feel like they are old enough to make their own decisions. I have talked to some of the staff, and they have also mentioned that they would like to see kids without masks. But I've also heard from a lot of them that they're okay with masks. And a lot of these kids are okay with masks as well. I understand completely what Mr. Champagne is saying. I agree. I walked around all summer without a mask. It kills me to put my little one back in a mask and send her off to school. But just today in Massachusetts, there were almost 3,000 breakthrough cases. Now, those people may not get very sick and end up in the hospital and, God forbid, die. But we really don't know. I don't know how my 11-year-old would handle getting COVID. And I don't know how I would handle getting a breakthrough case. So I think we do have to err on the side of caution here. And I will vote K through 12 masking, but only if we do away with social distancing, except for lunchtime. And I want to revisit it in October, definitely, possibly like re-vote on. I would like to see the high school lose masks as soon as possible. And I think it's a great incentive for other high school kids to get the vaccine. So that's how I feel about it.
Thank you for those comments.
Through the chair, can I actually, and this is actually to Jesse's point, so in agreement with reviewing in October, I think it would be helpful, actually, if Dr. Hanfield, I don't know if you could work with the Board of Health, if we could actually come up with some target metrics. Maybe there's something that we're looking for, like 80% of our high school kids in building that are vaccinated, or something like that, or a COVID threshold, a lower threshold for cases in the community. I think that might actually help give us something more concrete than like, oh, how are we all feeling today? You know, maybe survey the students, survey their parents. Any things that we can put in place like that, to Jesse's point, so that we could actually, you know,
See progress.
exactly.
Or even through the chair, having a committee, I'd be more than happy to be on it. With the nurses, with teachers, with everybody, so we can look at that data in our schools and go from there. And so that our kids know that we're working really hard to get them 100% back to normal. Because I don't want to see this in February. I don't want to see us in masks. And I don't have control over COVID. I would probably be a millionaire if I did. But I think a committee would be great.
Dr. Hanfield, would you like to speak to that before I comment?
Sure. Thank you, Mr. Chair. Yeah, I mean, so to the comments of the committee, I think we're all in agreement that, you know, our intention to return to school this year is to return nearly as close to, you know, as normal, quote unquote, as possible. You know, there still will be some mitigation strategies. As we talked, masking is a mitigation strategy. It's not a cure-all. We know that, but it does go, I think, you know, as a mitigation strategy. And you know, when I say and have said this evening that we're looking, there's got to be an exit strategy. There absolutely does. But I think we just have to be careful. You know, I think we've demonstrated, as I've said earlier, demonstrated an ability to, you know, to look at things in front of us and make good decisions to get our kids back in school and keep them safe. I think, you know, starting, you know, for the month gives us that opportunity, you know, to, again, gather data, you know, get the consensus, say, in buildings. You know, obviously it's going to make sense just based on who's vaccinated and who's not, you know, to start at the high school level and the middle school level. But yeah, we need to look at that. So we're not opposed. The administration is not opposed to that at all. As a matter of fact, that would be our preference, is to start moving away from masks. But we have to make sure that it's being done safely. It's not being done because we're mask tired. And it also has to make sure, we also have to the best of our ability, make sure that we're not doing something that from a logistical standpoint potentially causes an issue. And I understand there's chance in everything, but you know, from where I am right now, to start the school year, I don't think it would hurt to, you know, to take the month, and that's why the recommendation went forward. But I am in full agreement with the committee that, you know, we need to dig into this and you know, and look to see when we can start making some headway on this issue. Absolutely.
Thank you.
Through the chair, what about social distancing? Are we not doing that?
So, Dr. McCrillis, through the chair, we're following the guidance that we had in the spring, which was, you know, social distance to the best of our ability. It was a little bit more concrete in the spring with, you know, feet and, you know, 3 feet, et cetera. In terms of, you know, where we are in buildings, we have a principals meeting coming up on Thursday, and that's going to be the topic of our discussion. There's no way for us with all of our kids in our buildings to keep a 3-foot distance. There just isn't. We also understand and recognize the importance of kids getting back into working in groups and doing other things. So, you know, that's when I say that we're looking to go back to as normal as possible. That's what I'm referring to. Now, in terms of what individual principals may want to do in terms of their building patterns and things like that, you know, those are all things that we still have to discuss. But, you know, with the exception of lunch, you know, which is probably the most concerning because that's, you know, mask off and eating. Even that, you know, we're going to do our best to keep them spaced a little bit, but we understand the importance that that's a big time for socialization, right? And so what does that look like in our buildings? So I guess the short answer isn't really short. to your question, but, where it makes sense, we'll do that. But, every other time, it's going to be just like, again, whatever the normal lesson would be. If the kids would be in groups, we'd like them to be in groups.
I
So
just
on
would
and so
hate to
forth.
see kids in rows again,
Yeah.
3 feet apart, especially at the younger. I think the high school kids stay in rows.
No, usually.
The elementary never
classrooms
did.
are so much, the class sizes are so much smaller.
Yeah.
Anyway,
Right.
it's kind of magical.
Okay.
I would agree.
Thank you for those comments.
Sure.
And let me just start by saying that we're all on the same team here. Don't think that for a second, our commentary or our feelings put us on one side or the other. I will say I despise wearing this mask. It saddens me to see my children, even though they're at the high school age, wearing the mask. It saddened me to not be able to make those connections with my students last year, especially the incoming freshmen who didn't know me from a hole in a wall and couldn't get to appreciate my great sense of humor and my sarcasm because of the mask. And I couldn't see if they were smiling, they were intimidated, they were scared. So, believe me, I can't stand the whole idea of masking. As Mrs. Harrington just said, 3,000 recent cases. We really don't know where this is going. I do know that last year we had to close one of our schools for at least a day. That's tough. That's pretty tough when the children have to stay home from school because we had to close. The other piece is the lack of guidance from the Department of Ed. As Mr. Hanfield said, well, mark them absent. If they're out, just mark them absent. Okay, so they're going to be absent for 14 days. I also was able to see last year what that did to the students. So many students suffering, so many students felt like they couldn't keep their head above water. Many of them were throwing in the towel, and it was because they didn't have a teacher in front of them. They didn't have a responsible parent in front of them. They just felt helpless. So really, I feel like as much as, again, I can't stand the mask, I feel like right now we need to try to keep our students in school at all cost. And like Mrs. Harrington and maybe some others in this room and on this committee, I wasn't really sure where I stood up until maybe yesterday sometime. And that's because I'm torn. I want those high schoolers to have those masks. I want them to throw them out the windows of the high school and let them blow away. I want the same thing to happen for our middle schoolers and so on and so forth. I just feel like right now the responsible thing to do is to make sure that we get the school year off to a good start. We keep them in school. As everyone here knows, those transitions from one grade level or one school to the other, that's big. That's big for students. So having them come in for a couple weeks and then a whole section of the school has to be removed because spread is happening, and then they got to come back in 2 weeks later and try to get readjusted. I'd like to get the school year off to a good start. I don't know what the rest of the school year is going to bring. I would like to see some sort of a metric formed, and I would like to see some sort of a committee formed, as Dr. McCrillis just volunteered to do, and that's great. You can get that started whenever you'd like. I would like to see that because I want a month from now, and this is wishful thinking, but I want a month from now for us to be able to say, okay, here's the metric. Here's what the numbers are. This is what we're agreeing upon. Those high school students are going to get rid of those masks, and we'll take this thing head on, as Mr. Champagne would like to do. Let's take it head on. But we need to make sure that we don't have spread from the high school to the middle school, or I should say the other way around, from the elementary schools on up. We just need to be mindful of that. I want the kids in school. That's the bottom line. I want them in school without the masks, and we're going to get there. Unless this thing blows up the way it did early on last time, and I'm hoping that's not the case, we're going to get rid of these masks. And I just want to appreciate all of your commentary and it was a nice social discourse. Just understand, we're all in this together. We're all family. We're all friends. We all care as much about our students, their friends, our neighbors. That's why we're up here doing this. This isn't easy for any of us, and this is probably the most difficult decision that I've had to make. Not making it by myself, of course, with my fellow board members and the leadership team, but in the 10 years that I've been on the committee. This doesn't make me happy. I look forward to a time when we can see all the smiles of the teachers, of the students, of my fellow school committee members and all staff. We'll get there. Just bear with us. You could probably tell by my comments how I'll be voting. I'm very torn in doing so. Just understand that.
And through the chair, if I may, I just, while I'm thinking of it, I just want to, you made me think of it, you mentioned the social discourse. I want to thank, and I mean this with all sincerity, I want to thank the people here tonight. I want to thank the people out in the viewing audience. I want to thank the majority of people that have emailed us, because it really has been civil social discourse, no matter whether you're, on no mask, somewhere in between. It is not devolved into what we have seen in other communities. It is not devolved into, the things that you see on television. And I think there's something to be said for that we can have respectful conversation. We can have our own, we can form our own opinions. But that's something that we should take away from this too. And I don't want that to be lost, as we continue to discuss this moving forward. I really appreciate that. It's very difficult, to be in these positions, and I'm not complaining. I'm just saying, just to try to balance, everybody. So I don't want that to be lost. I do appreciate the civility and the counterpoint that people do make, because there are compelling cases on both sides.
Thank you for those comments. Are there any further comments? All in favor?
Hi.
Oh, hold on a second. We have one.
Oh.
I guess I'm so adamant about the laxing of social distancing that, is it uncalled for to put it in the policy, or?
I think that's on the next
It's in the
motion.
second motion.
Oh, it is?
Yeah, we'll talk about that one next.
Okay.
And through the chair, I split this out into two motions just because the masking was a hot
Yeah.
topic and needed to have its own, I felt. And then we could talk about what the mitigation
Okay.
strategies in
My
addition to that
apologies.
look like. So we could talk about that in the next, if that's the purview of the chair and the committee.
All in favor?
Hi.
Aye.
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 It is a vote. It's unanimous. Thank you. Okay, back to Dr. Hanfield. Dr. Chamberlain. You'll be handling the discussion regarding the mitigation review.
Good evening, everyone. Dr. Hanfield asked me just to share a little bit about what we did this past year and what we're looking at potentially for some of the mitigation strategies this coming year. In regard to the social distancing, there is no requirement from DESE at this time, except for at lunchtime, where they ask us simply to do the very best we can with the space that we have. So each of the schools are trying to expand their lunch spaces a little bit so that kids can have a little bit more space. But when we're looking at class time and in class, even in kindergarten, the tables are back. We are looking to make this a much more normal, as we know, school experience for our kids. We know they need that. We know they need that social interaction. But we also know that a lot of what we did last year helped to keep us in school, in large part, much more than many other districts across the state. So what we want is our kids in our buildings. And so if that means doing this for a little bit of time, and I fully agree with all of you, we do not want this forever. But to go back now without could be tricky, right? So some of the things that will continue to stay in place is, we've made a lot of investment in our HVAC units, right, through Mr. Fahey, and all of the high-quality air filters that were purchased last year, that stays in place. The Atmos air units that were purchased as air filtration for each of our learning areas will stay in place and functional. That's going to help. The cleaning protocols that we put in place last year, we found to be very successful, and not a heavy lift for our custodial staff once they got the routine down. That's going to stay in place as well. Proper hand hygiene for all faculty and students, that's another thing. And that's all good no matter what we're talking about in relation to illness in schools. We'll continue to use our outdoor spaces as much as possible. The kids actually, we've heard from many of them, love being able to go outside more frequently than they had in the past. To have a class session outside, that will continue as well, and students will get mask breaks at regular interviews. Zip slips, all my fans, I'm sure that are out there have heard me talk about this, but we will continue with that. Our nursing staff found that information invaluable to help kids, keep kids safe. As Dr. Hanfield mentioned, all kids on buses by federal mandate have to be masked, as well as the drivers. And we're going to continue to encourage folks, if they don't feel well, whether it's a student or staff, to please just stay home if they can. And as we've talked about here, masking was a big piece of this last year, right? So that's another thing that, based on your vote, will continue at least for a bit of time until we can reassess. And just to say, all of this guidance came out within the last week from DESE. It's all been shared with the Auburn Board of Health. Everyone is still trying to digest it because it's pretty complicated. It brings in a layer of testing within schools that we're currently exploring. It is provided by DESE with a company, CIC, who I believe did the testing at Fenway and Foxborough, those big places. They've already done it in school districts around the state. They've added some new options this year versus they called it pool testing last year where big groups got tested. They're now calling that routine safety checks. But what they've added to this is that anyone who's symptomatic in school can get a rapid Binax Now test in the school building to determine if they're very mild symptoms. Maybe it's just, I have a really bad headache. Last year that would have kept you home. If you're tested and it's negative, you'll be able to stay in school. And also test and stay for anyone who's unvaccinated but deemed a close contact. So that put a lot of our kids out for at least 5 days last year until they could get tested, get their results, and they had to stay home. This, if I'm a student, I'm a close contact to you as a positive person, I can stay in school, as long as I have no symptoms, I can stay in school. I need to get tested with the Binax Now 5 days in a row. Every day those tests are negative, I can stay in school. And all of this is provided free of charge, including the support to administer the whole program. So we have filed the preliminary inquiries to get more information about this through DESE, because in consultation with Leah Goffey, our lead nurse, she's committed. The nurses want to keep kids in school. They don't want to be sending children home for things that may not be COVID. And she sees this as one of the best possible mitigation strategies we could implement to save families from missing time at work and for primarily keeping kids at school. So, interestingly, and again, that's a voluntary program, so every family would be sent, an opportunity to either consent or opt out of that. So that's completely voluntary. But for the students that it might help, we're just committed to really having kids in school because we know that's where they need to be. Thank you.
Just through the chair, we do have a meeting scheduled. Well, it says tentative on the agenda for next Wednesday, the 25th. That's when we would talk more in depth about the different testing options, as Dr. Chamberlain stated. We literally got this Friday afternoon at 5 o'clock, and so as she said, we're trying to digest it, but what we'd be looking to do is next week talk more about this at the committee level, and then prepare kind of a 2-page synopsis to families of what is the COVID response in the Auburn Public Schools moving into the year. But I felt important to the mitigation strategies that we had in place last year. I felt it was important that we just affirm those, and I'm glad Mrs. Harrington brought up the social distancing piece as a concern. That's something that we've discussed, and I think we will be addressing. So, but I just wanted to clarify that.
I'll make a motion to continue mitigation measures in the Auburn Public Schools recommended by DESI to begin the school year. The continued requirement will be revisited monthly in the school committee in accordance with current recommendations from national and state agencies and a review of local data.
Do I have a second?
Second.
Discussion?
Through the chair, I just
Hoffman.
want to say I'm thrilled that it is going to be a less tedious pursuit to do the testing in school than what we were initially presented because we didn't have the support. So if it is as good as it sounds, yay.
Any other comments?
So it would just be what Dr. Chamberlain discussed with this motion, right? Nothing else? Yeah, okay.
Right, through the chair, it would be, yes, so through the chair, it would be, the motion would be based on mitigation strategies that we had in place to end the school year. And then next week, when we talked in more depth about the testing possibilities that we have this year to keep kids in school, because I think that's one of the pieces that's really highlighted, that if, you have the ability to come to school and test in school and stay in school, it's not that you have to go get tested and then bring us a negative piece. So that would be a change to the protocol. So we'd be bringing that forward to you for review, discussion, and potential vote as a change to our existing protocols.
Understood. And to sort of piggyback on what Dr. Hanfield is saying now, this is a fluid situation. So we could take the same vote next week, slightly altered, and then a month from now it could look a lot like it did, however, slightly altered again. We need to be able to move as quickly or as slowly as COVID. We need to be able to follow along. So, this is this message is going out to you folks at home and you folks in the audience. Continue to comment, continue to email us, let us know what your thoughts are on where we're headed with this, and we'll continue to make changes according to data and according to what we feel is best for our students. So your input is always going to be welcome there as well. Any other comments? Seeing none, all in favor?
Aye.
Aye.
I did have a second, correct?
Yes.
Okay, why is everyone so quiet? All in favor?
Aye.
Aye. It is a vote. It's unanimous. Thank you. Is that all you have for this evening, Dr. Hanfield?
Yes, Mr. Chair, just a point of clarification. We had on the meeting schedule August 25th as a tentative. We set that obviously not necessarily anticipating we were going to be in this situation that we're in now. So I would recommend that we do meet next Wednesday on the 25th. I'd also recommend that we maintain this site just for the purposes of spacing. The West Street site, as we all know, does not bode well for accommodating really any more than a handful of guests. So if that is okay with the committee, then we will get that posted as an official meeting.
Sounds good. I don't think we need to put that to a vote.
No, that's just a point. Yes, that's just point of information.
Yep. So we'll be meeting next week on the 25th. Is that okay?
And here at the high school.
All
Yeah,
right.
that's fine.
I would entertain. Did you have anything, Cecilia? No. I'd entertain a motion to adjourn.
Make that motion?
Do I have a second?
Second.
All in favor?
Aye.
Aye. There's a vote. Good night, everyone.